I had the most incredible snaggletooth smile, and I've always been really unhappy with it ever since I was a kid. And so I decided that what I wanted to do was, for my 60th birthday, I was going to give myself a present of having a new smile. And I went to see several different dentists before I came to see Dr. Gleave. And when I went to the other dentists, they told me about what the procedure was going to be like, and it scared me to death. I had this really horrifying kind of vision built up in my mind about how much pain I was going to be in and how much I was going to have to go through and what the ordeal. And I had myself convinced that I couldn't endure it unless I had a general anesthetic. And no one was able to talk me out of that until I met Dr. Gleave. And he explained to me the kind of sedation that he was going to use. And it made perfect sense to me. And so I decided, okay, I can relax enough now. I can do this for myself. I can do this. And it was amazing. The sedation was, I fell asleep in his chair. They had to wake me up to get me out of the chair when the procedure was done. I was never uncomfortable. I didn't remember anything. It was absolutely fabulous. It was a piece of cake. It was wonderful. And look at my beautiful smile. It was great.
It's pretty typical of the patients that I see that are interested in their smile. A lot of times they've put off addressing their smile for a variety of reasons. It's either money, it's the fear, like maybe a combination of the two. And so the comfort of knowing that we can sedate patients is huge. And then also just addressing the complex. Beau's case was very complex for a veneer case just because the teeth were so malpositioned. She actually had really pretty teeth, but they were so badly positioned that she really had to go through braces as a good option. Now, she was just not interested. We presented braces as an option, wasn't interested, and I can't blame her. She wants something done in a couple weeks. She's lived with this smile for 60 years and wanted it fixed. I don't want to wait 3 years and get my teeth fixed. And veneers worked out wonderful in her case, and I think she has a tremendous smile now.
Yeah, it's
straight,
great.
it's beautiful, it looks aesthetic, it's glamorous, and I'm really happy about the results.
Dr. Gleave was just wonderful with me. He really was. And I'm no spring chicken. So I've been around the block. I'm not a person who is, shall we say, easily led. Once I have confidence in a person, I'm certainly willing to put myself in their hands. But you have to convince me. I have to really believe that a person knows what they're doing. And Dr. Gleave knows what he's doing. And I had absolute confidence in him. He was very patient with me. He was very gentle, very sensitive to the fact that I was just flat afraid. I've had some experiences in my past with dentists that were less than professional and less than gentle, and that's putting it politely. So I really come into any dentist with kind of some trepidation. And Dr. Gleave was able to put me at ease very, very rapidly. And that's no small task in my case.
Well, it's funny you talked all about being anxious because I don't even remember that. I don't remember sedating. I guess I remember we sedated you now, but you were just like a model patient as far as I remember.
Aww.
I mean, your main concerns for me that we dealt with were the crookedness of the smile.
Yeah.
And you just had always wanted to have this dream, beautiful smile. Yeah. And so in Beau's case, we were able to accomplish that with a better understanding. We took a lot of digital photos. We reviewed the photos. Yeah. We did a diagnostic wax up where we took her smile and started creating the smile in wax before we went to the teeth. Once I understood kind of the dimensions of the smile that I wanted to build in and where the position of the teeth should be, then we start looking at shade. And we use the shade by going off the digital photographs. We blow those up, we look at shade tabs. We look at smile design books. We picked out the smile we liked for her, and we proceed from there.
Yeah, it was a fun process actually to go through, to pick out your own teeth. I mean, what a concept, right? You know, you get to pick your own teeth, and looking at the different styles of teeth and how your smile might be different depending on what your choices are. Wow, that's my kind of shopping, you know. You know, it's interesting that you asked that question. I was thinking about that a little bit earlier today, and because I am a public speaker. I do a tremendous amount of stand-up comedy in my line of work. And I'm also a therapist. And your appearance is very important to success. Obviously, as a public speaker, that I'm sure is obvious to anybody. Might not be quite so obvious when it comes to being a clinician or a therapist. But how people perceive you makes a big difference in terms of how you can have an impact on them. For better or for worse, in our culture, beauty is power. And you have a very different impact in terms of persuading people, selling your ideas, influencing people, depending on how you look. So I think it's made a tremendous difference. Certainly, I'm more self-confident than I was. And I think I'm having a better impact on people, honestly. And my husband loves it.